everybody, and welcome back to another edition of Nexus Connexus. And today, Nexus connects us to Dr. Marc Newman. Now, Dr. Marc, you were on the show about 2 years ago, and we did a brief segment talking about veterans, talking about your practice. Welcome back.
Hey, thanks for having me, Derek. I really appreciate Nexus and you allowing me to come back and share some of the updates with you guys.
Absolutely. Maybe, Dr. Marc, why don't you tell the audience a little bit about your practice and just where are you located? What kind of dentistry do you do? Let's just get a little bit of the background here.
Yeah, absolutely. We have two office locations. Our mothership office is in Indianapolis, over on the west side of Indy, near the Eagle Creek area, kind of close to the airport. And then our other office, where we expanded to, is in Carmel, which is a north suburb of Indianapolis. And I work pretty much 5 days a week doing general dentistry. I also blend in sleep medicine into the dentistry workflow. I have an older brother who's a dentist. He's the one that pretty much started the practice, or took over from our uncle. And then I have a younger brother that is also in the practice.
This is a whole family affair.
It is.
How does that dynamic work, Marc? You know, I've worked with some family businesses in the past. I mean, do you have just boxing gloves that you all use, or how does that?
Well, early in my career, when I wasn't as busy, I had boxing gloves with me and my younger brother. We're about 2.5 years apart. And so we're a little bit closer. But my older brother, he's about 12 years older than I am. So we don't really, fight. I work pretty much side by side with him 4 days a week, while our younger brother manages the opposite location the other days.
So what was your interest in dentistry to begin with? I mean, is it because it was a family? I mean, it sounds like it was a little bit of a family tradition here. Your uncle was in this, your older brother. I mean, is this just sort of like the moment that you were born, they just christened you with dentures or something, and so, you're gonna have to go through some sort of ceremonial. How did that happen? Was that a personal interest? Was it a family interest?
Yeah, I mean, it was a little bit of both, I would say. My grandpa was a pharmacist, and so we would always go over to his house, and he'd sit with us at a very young age and talk to us about our careers. And I'm 5 years old and no idea what I want to be. But, year after year, or, week after week, we're talking about healthcare. And he always thought it would be a good idea for, his grandchildren to take a job in healthcare, knowing that there's stability in that industry. And I've always gravitated towards, math and science and stuff like that. Did pretty well in school. And, just with the external influences of my uncle, my older brother, and we have some cousins that are in dentistry as well, too. Okay. I just kind of naturally fell into that path.
So tell me a little bit about when you got into dentistry. Obviously, the sleep aspect of this was not part of dentistry. Your grandfather and your older brother weren't doing this stuff years ago. It's a relatively new addition to the dental industry. Tell me a little bit about that journey. How did you get interested in sleep apnea? What did that look like from sort of a development of the skill set? Give me a little bit of that background.
Well, any dentist that joins a practice, especially as an associate dentist, they got to find a little bit of a niche, like it's almost like a specialty, in order to eat what you kill, if you will. Yeah. And and when you're working with your older brother and your uncle, at least for my first year, with those guys, they did just about everything you could think of under the sun. There was not really a specialty that I could bring into the office. And so, I just was basically a glorified hygienist for about 6 months, doing child cleanings and general dentistry, and just kind of grassroots marketing, just word of mouth. And the schedule wasn't really, picking up for me per se. And then once my younger brother came into the practice a year later, my uncle left. Me and him, like I said, we had the boxing gloves. We're fighting for new patients. We're fighting to see who sees the emergency patients and stuff like that. And so I'm just, doing some research, just Google searching and reading up on, dental journals, and kind of just stumbled into sleep dentistry. One of my good buddies was diagnosed with sleep apnea. he lived up in Chicago. He became CPAP intolerant and found a dentist in Chicago and got fitted for an oral appliance. And just so happened, after I found out about his journey, there was his dentist that fitted him was teaching a course up in Chicago, and I took his course, and that's when I became obsessed.
Well, I mean, it's such a great origin story because I have to tell you, I have some friends that are dentists, and I've talked to, hosting this show for 2.5 years, talked to lots of different dentists, both that were associated with Nexus and were doing this work, and then the other ones that were still on the sideline. And the ones that were on the sideline tended to probably be more like your uncle and your older brother. They have established practices. They don't really need any new offerings, right? They're interested in these things because they see them in the dental journals, but it isn't like there's a young, hungry younger brothers that are going, hey, we got to make a name for ourselves here. So it's interesting how I think because of that formulation of that pathway, it really maybe pushed you down into that to find something that was a little bit unique. And then having a friend that was dealing with it as well, helped solve that problem. So what was your first entry into this? How did you bring that initially into the practice? You went to that training, it sounds like. Did you immediately launch into a practice of focusing on having a focus on dental and sleep at that point?
Yeah. So, I've always wanted to blend in sleep with the general dentistry practice. I never had interest in going off on my own and doing sleep only. Mainly because at the time, I'm literally 2 years fresh out of dental school. I got to feed myself and my girlfriend, who is now my wife now. And so, it's just one of those things where I brought it back from that weekend course. Like any weekend course, you get a packet of stuff. You have the tools to try to implement it in the office. And then, we tried and no one really knows what to do. They're kind of leaning on me for advice and having absolutely zero experience other than that weekend course. We're just like, we're going to have to, go on the fly and try and make this happen. So we, through a lot of trial and error, we got something workable for about 6.5 years until I met, the co-founder of Nexus, Brett Brocky.
Yeah. You really are a bit of a pioneer in that, right? It's not like there was, although it was an offering but you still had to sort of figure it out on your own, which is interesting. And tell me about that. How did you meet Brett and what was the aha moment there? Because you had already been doing it. It wasn't like you needed them, right? You had figured out a path forward. What made you excited when you got a chance to meet Brett and started to understand more about the offerings that Nexus could provide?
Well, if anyone follows me on LinkedIn, they know that I usually put a couple, hip hop rap lyrics into my posts, and it was right around COVID time where our office was shut down for about 2.5 months. I started to get on LinkedIn and post a little bit. And I saw all the dental sleep medicine guys are posting on LinkedIn, and just I think one of my hip hop lyric posts attracted Brett Brocky there, and we connected, and I'm telling you, within like 10 minutes of talking to him or less, he had already identified the problem that I was going through, had the solution immediately, and it was just a matter of time before we got the Nexus system implemented. That we were like I said, I had about 6.5, 7 years of experience already, that we were able to just fly with it.
That's amazing. So what was that when you talked to Brett? What were the holes that you saw in the practice at that moment in time, and what were the pieces that Nexus filled for you?
Well, it had to do with screening, number one. We still have that as a hole in the practice, but it was mainly getting patients to identify that they had a problem, and then once they identified they had a problem, as far as or being at risk, then being able to get them sleep tested quickly, and then getting the documentation for medical insurance back timely and neatly, and then getting our patients treated efficiently and effectively, and having follow-up protocols, and all of that just seemed to be sort of like a fly by the seat of our pants approach. We were somewhat organized, but with the Nexus protocols, we became highly organized.
I love that. I do a lot, and I think we may have talked about this last time. I do a lot of work in the process world, right? And systematizing organizations. And I just gave a talk in Vegas this week, and we were talking about this exact topic. A lot of people don't realize that, that McDonald's, we see them on every corner. But McDonald's, if you look back at the earliest signage from the first McDonald's, it didn't say, it had arches, but right on the sign, it said McDonald's Speedy Service System. And that's what they were. They weren't actually a hamburger place. Everybody could make a hamburger. It was a system that they had created to deliver hamburgers in a very deliberate, immediate way that caused them to be the success that they were, where everybody else was fly by the seat of their pants, right? How do we put it together? Do you do this? Do you do this? What step? Everybody else had a checklist, but McDonald's actually drew the process map and said, step 1, step 2, step 3, here's the policies and procedures that went along with that. And I think it's very easy to underestimate the value of that. And I think you didn't, because you had experienced it for 6 years and you knew, everything was a little bit, yeah.
Well, I mean, like anyone in dentistry knows that general dentistry is pretty much chaotic. The front office, who I was leaning on as a sleep coordinator, it's impossible to have a front office dental person also become a sleep coordinator. We were administering home sleep apnea tests, that were one night tests, and then the patient would take it and have to bring it back. Brett introduced me to a telehealth sleep medicine company where we could, instead of administer sleep testing through our office, we take that burden away from our front office, and then someone else takes it. And they're utilizing medical insurance on the sleep testing, and we were just doing it for free. So then, so now patients were able to utilize their medical insurance. There's actual documentation that comes back from a medical provider with a prescription for treatment. And it just cleaned up, just a process to get the patient started. And it was on, when they see the sleep test that they have a problem, then they became more concerned. And then we're able to then help them more. And then with the on-site training with Stan coming in and training our assistants, treating sleep was no different than, doing a crown or, an implant or anything like that.
So yeah, it really just sped that. And I've interviewed Stan. I actually, Stan flew here to Phoenix and did my scans, which was really sort of cool. I got a chance to do that. And I would agree with you. I mean, it's just a professional operation. I mean, that they're letting you do what you're the master at doing, to work with your patient, and they are just providing all that support on the back end that candidly, you're right, that the folks that work in dental offices haven't been trained on how to do. It's a totally different mindset. They're not in the same flow. They have to think differently and communicate differently. And those things are, a real challenge. And I'm so glad to hear that streamlined. And that was what, around 2021 or so, 2022? Around 2021 is when we had Stan in the office training our entire team versus going to a weekend course and bringing our team someplace else to get trained. Right. I mean, I do a lot of workshop training myself, and the biggest, it's like whatever I charge, I have to figure it costs double because they got to fly everybody in, hotels, meals, Ubers. Right. It gets expensive quickly.
Yeah. We start on the same page, like putting our next step forward. We at least have the same foundation, which was super helpful. And the team doesn't really lean as much on me anymore now that we've had 3 years, at least 3 years of just experience, not changing our system at all or hardly at all.
That's incredible. Now, something that you mentioned, which I really wanted to drill in on, is this screening aspect, because, as a dentist, I mean, this is not something you were taught in school to be looking for and having these conversations about how somebody's sleeping. Can you maybe explain that a little bit? What does that mean when you're talking about screening? Is this something you're doing with every appointment? Is it part of the hygienist routine? How does that work?
In our workflow right now, and what we've been doing for the last few years, it's mainly just been implemented on the new patient side of things. So as part of the new patient intake, once we get them back in the chair, we're asking them about 4 questions chair side to see if they are have positive risk for any sort of sleep breathing disorder. We would like to get it implemented on our hygienist side. However, it's a little bit more challenging when we're dealing with our hygienist, because it's always like they always interpret things as like one extra thing to do, or we run into, well, if they screen positive, then what do I do? And I'm not always around to help guide them, but I do have a sleep coordinator now, which has been helpful. So they're still a little bit iffy about the screening, so we keep it on the dental side.
I can't believe that I can actually talk to this topic, because when I was with Stan at the dentist office here locally, he had one of the hygienists because she happened to be helping us coordinate. And what he told her to do was so simple. As he's like, hey, look, whenever you're always looking for things to talk about, there's always going to be some small talk. He's like, all I'm asking you to do is ask the question, how do you sleep? And if they go, meh, just take a pink sticky note at the end and literally put it on the file and say, this is somebody that might have a question. If you're uncomfortable with any conversation, simply ask the question, how you sleeping, right? It's just something to sort of encourage that. And that's one thing that Stan is very good at. He's good at getting people to extract information so that he can do a better job at his work.
What's neat is that how Brett is like, Star Wars, everything.
Oh yeah.
And like, futuristic, always looking at what can we do with technology to implement things faster and more accurate. And so I know we got a new way of implementing screening that we're looking at in the future that involves basically hardly anything at all, not even asking really a human asking another human questions. It's more of an app type of thing. Yeah, I'm excited to see how that goes.
Absolutely. So I mean, we talked 2.5 years ago. I mean, you were about halfway through your Nexus journey, where you are today versus where you were then. It sounds like the system is relatively stabilized for you.
Yeah, totally.
Not a lot of variation in that. Are you doing sleep work in both in both locations as well?
Yeah, at both the Indianapolis and the Carmel locations. I convinced my older brother and my younger brother to pitch in to buy a iTero scanner at each office, which the scanning has totally streamlined the process. Like, oh man, now we can really scale the process with intraoral scanning.
I think one of our older episodes, they even showed me getting my mouth scanned, because I had gone and done first when we were when I first had started working with dentists. I had with Nexus. They had to do the foam, right? They had to put all the stuff in my mouth, and then something happened and it didn't print right. It didn't imprint right, and I had to go back. And then, Stan's in town. He's just like, zip, you're done. So it was very cool to see how that technology aspect has come into this. Dr. Marc, maybe let's talk a little bit in our last 5-10 minutes here about the impact on patients, because yes, this is another profit center for the organization. It expands the scope of your practice beyond just what's happening in the chair, but it's really a consistent helping somebody throughout their life. How has that worked for you? What have you heard from patients?
Oh, it's life changing for our patients. I mean, just this past week, almost every consult I saw, they were pretty much done with their CPAP. They're having a hard time sleeping with their CPAP, and almost on everyone, they're done traveling with their CPAP. And so just being able to be compliant with the treatment and have the freedom and the room in their suitcase to travel has been like just those little things. They're just like those little nuances that mean a lot to these patients. But then not only they're able to breathe better at night, their bed partners are happier. People are re-entering into the bedroom together. Yeah, it's been really, really a nice thing to be in the circle with them.
I have to tell you a funny story. I talked to another dentist that had done work with Nexus. Very similar feedback. Was like really people very, very satisfied. I'm a client, right? I went from 47 instances an hour to 0 with that device, and I keep one in my travel bag so that when I travel, I don't have to take a CPAP. I have one in my motorhome so that when we travel, I don't have to, it's just the simplest little thing. But it's interesting in that dentist instance, they were like, a customer confided in me. It was like, I actually got a sex life back because my wife and I sleep in the same room again, right? Which is something that hadn't happened in a while. And he was like, so I'm happy. I'm satisfied in all regards. Right? I don't think he's going to write that in the Yelp review for the dental practice, but it is cool to think about that, right? The truth of the matter is that we all want to sleep well at night, and having a partner that's struggling affects your sleep as well as it affects theirs. And being able to reunite back in the bedroom and everybody get a good night's sleep out of the equation is a really good thing.
Yeah, absolutely.
So tell me a little bit about, I know we've talked about it on other episodes, but what would you say is the one big takeaway from Nexus? What is the thing that they provided to you? Is it the medical billing? Is it the system? Which of those things do you feel like was the catalyst for you really to grow that piece of your practice the way you have?
If I had to pick one, it's the medical billing component, because as we know, businesses can't survive without financial stability. Sure. And patients, they want to utilize their medical insurance on this. I've literally gotten patients to drive an hour and a half away when their dentist provides the same therapy, just so they could utilize their medical insurance, because the cost savings for them is totally worth it. And then the reimbursement on our end with the new Nexus contracts has been well worth it for us.
Yeah, it's funny. I have a friend who was a former NBA player that was not tolerant with the CPAP. And when I first started doing this, I think he flew to Atlanta or Tennessee. He literally got on a plane, flew across the country, and was like, "I'm going to go get this." Yes, there were people here locally, but Nexus didn't have anybody at that moment in the market here in Arizona. And he was like, "For the price of a plane ticket, I'm going to go get this solved, and I can use my insurance. I'm just going to do it." Right? Totally. So you really don't think about that sort of tourism type dentistry. You think about that south of the border to get veneers and those kind of things. But it's a very impactful, important part of people's lives. I mean, we spend a third of our lives sleeping. Why not try to improve that experience and make it as good as possible? Right. Dr. Marc, in closing here, tell us a little bit about where are the two locations? How do people find you? How do they get a hold of you? Those kind of things.
Our locations, like I mentioned earlier, around 38th Street and Eagle Creek Parkway near Eagle Creek, over on the west side of Indy, and then over on the west side of Carmel, so like 106th and Michigan Road. And they can easily find me through my website, Indy Sleep Apnea. That's INDY sleepapnea.com. And there's a book or request an appointment button. They click on that. And my coordinator, Angela, will be all over them.
That's great. Yeah. Dr. Marc, thank you so much for coming back and being featured again here on Nexus Connexus. And thank you all for tuning in. If you'd like to find more information about Nexus Dental, you can check out the website. And if you're in the Indianapolis area or willing to travel, Dr. Marc is he's close to the airport. He can you can coordinate to fly into Indy and get things taken care of. Dr. Marc, thanks so much for joining us today on the show.
Yeah, go Pacers.
Thank you for that.
In the human race, and we won't stop dreaming. No, we won't stop dreaming. We won't stop dreaming.